Cancer is now more on the global agenda, but when we look at the big picture, still is not among the priorities in most part of the world. This is number one issue, to take the cancer on the global agenda and the agenda of the governments. We should press governments, we should increase the civil society awareness, public professional awareness. Then by taking cancer on the agenda of the governments, I'm sure we will have a big progress on the prevention and treatment of cancer. Many people around the world are doing something, but we can only succeed to defeat cancer if we work together. This is very critical. United Nations, WHO, IAEA, cancer societies, government, a lot of people and a lot of organizations are doing many things, but joining our forces will accelerate the progress.
So it's very important for governments to realize that it's not only about the upfront cost. There are certain things that could keep that radiation oncology facility going. So for example, you have to be sure to include maintenance costs in your calculations, and you have to be sure to have long-term costs of training and bringing in the right people. So we have a huge team that has to be involved, like radiation therapy technologists, radiation oncologists, medical physicists, radiation oncology nurses. It's a huge team, and each one needs significant resources to train them. So they have to be taken into consideration. Not only that, but there's also upgrades. So as the technology improves, you have to keep investing in that and upgrading the technology. And very important is quality and quality assurance, and that's where the IAEA is very helpful in, for example, special missions like Quattro missions to check that the quality of radiation oncology facilities is good. And that's done through the IAEA as well for member states. It's really important to have a safety infrastructure as well, and a legal component for managing radiation in general. So that's, the safety infrastructure is also very important, and that's the first step for everything.
Well, thank you. This is a very pertinent question to the work of Pink Ribbon, Red Ribbon. And I think the best way to answer it is to illustrate with the story of one of our beneficiaries. Her name is Evelyn, 34-year-old with 6 children. She went into one of the outreach clinics that we support, and she wanted to have screening for cervical cancer, which she had not had before. And she was told she had suspicious cancer. She was immediately sent for tests to confirm or disprove. Within 24 hours, they were able to confirm that she actually had advanced cancer. And she was referred to Lusaka, Zambia, which is the capital city, where the only cancer treatment center is. Of course, she didn't go because she could not make the journey. She didn't have the money. She did not have relations to stay with in Lusaka, and so she stayed home. The partner who did the outreach, PCI, found that she had not reported for care and decided to contact her and make arrangements to transport her physically to the center. A day before they were supposed to pick her up, she died. Evelyn left 6 children and an aged mother. There are 60,000 other Evelyns in sub-Saharan Africa who have no geographical access, no financial access, no service access, no quality access. So these are the points, the facets, the components of cancer care with respect to access that we need to look into.
Thank you very much. For quality delivery of radiotherapy, you require at least minimum 4 steps to be looked at. The first is that of the state of the equipment itself that you are going to purchase as a country, and you need to select it very well so that it suits your burden of disease. And secondly, you need to have trained and skilled manpower to be able to deliver the radiotherapy to the patients so desired in a manner in which you reduce risk as to minimal as possible. And then the third thing you need to look at is the servicing of your equipment so that it remains in a good state. As you know, radiotherapy machines, once you purchase them once, they will have to be used for a period not less than 10 years to 15 years for you to actually benefit as a country. And if you don't maintain this equipment in good working order, then the machines will break down. So it is important that countries begin to look at the provision of service contracts for these machines to be to remain in good working condition. The third thing is, in most of the lower and middle income countries, Zambia included, we have a lot of difficulties and challenges in terms of power. So you need to actually control that, the power supply, you need to do a lot of power conditioning so that the power coming into the radiotherapy equipment is stable to prevent the radiotherapy equipment from breaking down because of power surges. Additionally, you need a lot of other environmental controls in terms of temperature, water quality, and humidity for these units to continue giving you the service you require.